Council for the Medical Schemes has published a new circular focusing on how COVID-19 should be covered by the country's medical aids. The council cites that routine RT-PCR testing of asymptomatic, unscreened and unreferred patients, which turns out negative, is based on scheme rules, implying that it is up to the medical aid scheme to decide whether they will cover the routine testing or not. As we discuss the rights and responsibilities of medical aid schemes and beneficiaries, I'm joined now by Senior Clinical Manager at the Council for Medical Schemes, Dr Olurotimi Modupe. Dr. Modupe, good evening, and thank you so much for your time tonight. So the question then is it fair that medical aids will not cover a test for an employee who seeks to return to work?
Well, good evening, and thank you very much for the opportunity to join this conversation, and good evening to your viewers as well. The CMS, at the onset of this pandemic, sought to declare, and through the Minister of Health, COVID-19 as a prescribed minimum benefit. And that he has since assented to and generated COVID-19 as a prescribed minimum benefit diagnosis. And the benefits linked to this diagnosis include screening, which would be covered as part of a consultation with a healthcare practitioner, testing, treatment, including hospitalization and medication, as well as rehabilitation, including OT, dietetics, and any other relevant care. Now, specifically on the issue of what would not constitute prescribed minimum benefit level of care for this diagnosis, the most important thing is that we are emphasizing that based on the current NICD and National Department of Health guidelines, we are encouraging that testing should be healthcare workers initiated. And these healthcare workers could be a specialist, a GP, or even or any other healthcare worker, including a nurse who may be looking after this member or beneficiary. And that's why we're saying that, for instance, if an employee seeks to return to work and there is an initiative by the employee's doctor or nurse who is looking after him that he is recommended for COVID-19 testing, these should be covered as prescribed minimum level of care. And remember, one of the issues is that the testing itself is a strategic resource that we have to use in a very strategic manner in order to combat this pandemic.
So are you saying this recommendation is in order to discourage people from going to test unnecessarily?
Well, I would not put it that way. We are saying that, remember, testing is part of the basket of care that this member would be entitled to. It includes consultation, it includes testing, medication, hospitalization where necessary, and rehabilitation. And so we do not see testing as an isolated tool that will be used in the fight of the pandemic. Yeah. It is part of a holistic basket of intervention. Yeah.
But why is it not available as a minimum health service, regardless of the benefit or the option?
It is available, and that's the point that we're seeking to make here, that testing is available as long as it is health worker initiated.
Why the condition? That's why I'm asking why you are attaching a condition to it. What's the reason for the condition?
Because even the result itself of the test needs to be used as a tool to manage patients further. Because, I mean, if, for instance, one goes and tests and then what? If that patient or member still needs to be managed, as part of the holistic care for this member. And that, we're saying, is PMD level of care.
Talk to me about why the scheme decides not to cover the testing of, in the words that you put, a healthy baby born of a COVID-19 positive mother. We do know that we've seen a number of cases of neonatal kids coming out positive. We know of triplets who tested positive for COVID-19 at birth. We are looking at that similar case here in South Africa. Why is that test not covered by the medical aid schemes?
No, the test for newborn, the evidence for transmission of congenital COVID-19 as of now is not clear. And so that's why we're saying that based on the NICD guidelines, practitioners and healthcare workers need to have a low threshold for initiating testing of these babies. And as long as they initiate these tests and request for them, it should be covered as a prescribed minimum level of care for COVID-19.
And the pricing of these tests, is the council or the medical aid scheme at all negotiating with private facilities to give this at a reasonable price so that it's not heavy for your members? I mean, the test is, I believe, costing about 400 rand to be done, plus the consultation, plus other blood work that needs to be done. This comes very close to 1,200.
Yes. Indeed, we are mindful of the fact that a reduction in the cost of this testing will be very key in future. And I think as the rollout increases, as more tests are done, the CMS is currently engaged with industry players to ensure that the cost of these tests becomes affordable and sustainable, both to members and schemes and funders alike.
Do the various schemes have sufficient reserves to deal with the worst case, which is what we're going to be dealing with going into the peak of this pandemic?
Indeed, the CMS is very, we have emphasized the fact that most of our schemes are in healthy reserves. They have healthy reserves. As you know, that they have been holding a minimum of 25% reserve. And at times, and a lot of them have way over that. And we see these are the strategic resources that could be deployed as the pandemic rages on, as we approach the peak of this pandemic, perhaps in a few months' time. So we think that the solvency of most of our schemes are healthy enough and are able to fund members appropriately where these funds are needed in the care of members.
Dr. Olurotimi Modupe, there joining us, Senior Clinical Manager at the Council for Medical Schemes.